Ai. I'm from the Department of Pediatrics, and it gives me great pleasure to introduce our next speaker. Catherine Rogers is here in UC Malaya as a specialist in narrative medicine with the Fulbright Specialist Program. It's the first time Catherine is here in Malaysia, and we held our first full sort of introduction to narrative medicine workshop, and it's the first in Malaysia. We held it last week. So this is Catherine's third fellowship with Fulbright. She has a Master's of Science in Narrative Medicine and has been teaching narrative medicine at Columbia University in New York since 2015. Catherine is a playwright and a performer. She obtained her MFA or Master's of Fine Arts in Playwriting from University of Texas, a prestigious program that only accepts 2 fellows each year, and has been teaching playwriting for a very long time. So it was in about 1989 that Catherine thought of that the arts and medicine really belonged side by side, and came together when she met Rita Sharon, who is an internist at Columbia University, who actually founded narrative medicine about 24 years ago now. So without further ado, I invite Catherine to share with us her lecture on narrative medicine, bridging the gap between humanities and science.
Hello, everyone. I'm so happy to be here with you this morning in Kuala Lumpur, speaking to back home this evening in New York and whatever other time zone you may be in. First, the thank yous to Fulbright Malaysia and the MACI, the Malaysian American Commission on Educational Exchange, who funded this 2-week narrative medicine residency, first ever narrative medicine Fulbright in Malaysia. Thank you, Dr. Chong, who trained with Narrative Medicine Columbia and whose tremendous planning and organizing made possible this first ever narrative medicine residency through the University Malaya Faculty of Medicine. And also thank you, Dr. Rita Sharon, and all the participants here today from Columbia University, New York, Division of Narrative Medicine, where I'm the Associate Director and Lecturer. I'll be home by Monday to start my classes, don't worry. Today's questions. Thank you, Fulbright, University of Malaya and Columbia. Today's questions: why the arts and humanities, and why narrative medicine? And that's Rika Burnham, teaching medical students in the Art Museum, Interpretation as Experience. Why the arts and humanities? Medical training. It's training, primarily traditional medical training in science, professional practice, anatomy, physiology, microbiology, doctoring. Clinicians become, after this training, superior technicians. They learn to treat the body and diseases. And of course, there's that old myth of the left brain. Arts training, by contrast, is stereotypically thought of as airy, creative, imaginative, imprecise. Oh, maybe it's for fun and entertainment. That's the old myth of the right brain. Of course, the left brain, right brain is thought to be a myth now. And both doctors and artists need to be precise and need to be creative. In one of the most important professions on earth, the care of the human being, surely it's necessary to have clinical training, science training, and training in the arts and humanities. I mean, the disease doesn't walk in the door. The human being walks in the door. And that's where artists and humanists contribute to medical education and to medicine. Because artists and humanists practice those skills. They train in emotion, in relationships. They train in understanding the body, the spirit, and the mind. They train in the lived experience of the whole human. They work always in ambiguity and uncertainty. Well, so do doctors. And so arts and humanities and clinical training have a lot to teach each other. The belief that arts and humanities belong in medical training is really growing. You can see from this chart, 1975 in North America, there were fewer than 20 programs in health humanities at the baccalaureate level. Whereas in 2023, we see more than 140 baccalaureate health humanities programs in North America. So where does narrative medicine come in? Well, narrative medicine is a specialized track of medical humanities. It's a branch of medical humanities that arose at Columbia University in 2001 when Dr. Rita Sharon, who'd been treating patients as an internist, said to herself, there's something I'm missing when that patient walks in the door. What is it? And she said, it's story. I was trained in all those sciences, but I was never trained in how to analyze a story. Where could I do that? Well, she went to the English department, and sure enough, Dr. Maura Spiegel, literature professor, was there. Dr. Sharon said, could you teach a doctor something about story? And Maura said, of course, there's a science. It's called narratology. And so Maura and Rita discovered that the skills developed in analyzing a work of fiction are some of the same skills that will be very useful, not only useful, but required for a physician in analyzing the story of the patients. And then not only the story of the patients, but the story of their team members. Not only that, but the stories that each of us carry, the self-awareness. The clinician is not just analyzing fiction. Clinicians are dealing with the lived experiences of human beings, the whole person. And so as Rita and Maura were talking, they thought, you know what we need is a philosopher. And they found Dr. Craig Irvine, a specialist in phenomenology, relationships, what it means to be a human being and what it means for one human to work with another. So they put their heads together. Eventually, they attracted some artists, some social scientists, and their studies together in literature, philosophy, creative arts, and social science strengthened these three movements. It strengthened their attention, their powers of observation. It strengthened their powers of representation. In other words, expressing what they were thinking, expressing what was going on, even the subtle things. And it also strengthened their ability to bond with each other, their affiliation. And you can see that these strengths are necessary strengths for good medicine. How does it work? They developed a signature method of narrative medicine for one thing. And one example of the signature method takes place in a very simple 1 hour narrative medicine session. And in that narrative medicine session, here's what they do. They strengthen attention by doing some close reading or close looking. You saw Dr. Burnham with her medical students closely looking at a piece of art. Or they may close read a poem or a section of a novel, or closely look at a film together. This would be a group of clinicians around the table. We've done it with patients. We've done it with mixed interprofessional groups, looking together just for 20 minutes at a piece of art, a text. And then the facilitator who's trained in narrative medicine will give the group a prompt. And there we have representation. The group will write freely just for a few minutes to this prompt. And that reflective writing strengthens their powers of expression. Sometimes what they put on the paper is something they didn't even know they were thinking. And then to cap it off, and to strengthen the affiliation and the bonds, the groups will read to each other what they have written, and they'll reflect on each other's writing, much as they would reflect on the text of a poem or a painting. So here's an example. We might all look at this painting together and we say, what do you see? What do you see? Somebody will say, oh, I see a man looking intently with his hand on his chin. They'll say, oh, I see a little girl on a chair. Oh, eventually they might see in the background another man, and they think maybe that's a father looking at a doctor, looking at a sick girl. And many people don't even see this mother with her head down on the table behind. They say, where's the light coming from? Who's important in this painting? What's on the floor? Is that a tissue? Is that blood on the tissue? They might try to diagnose, etc., etc. We'll talk about that for about 20 minutes. And then after that, we might say, write about a time you gave care. We give a prompt. You notice about that prompt, we're asking people to personally enter that artwork, Not write about a time a doctor came to your house and said something. Write about a time you. And so the writer participates and gets their personal reflections on the paper, and then they have time together to talk about what they heard. And this creates a sense of affiliation or bonding. And you can see that strengthening attention, something that doctors need to do. You can see that being able to express what you see, what has happened to your team, to your attending, to each other, to yourself, to your patient, to express, some action that might be valuable for them to take. That's all important, and it's practiced when we write together. And then the bonding, the understanding each other, the developing in a safe place these relationships. It's good for teamwork, it's good, and it's good for self-care. In addition to this signature method of sitting around a table for an hour, Rita, Craig, Maura, and others determined that a narrative medicine would be great to add to the curriculum for medical students. And so they were able to add an elective in narrative medicine, which is required for all 120 medical students at Columbia. And so the first year medical students get a choice among 12 to 14 electives that they can choose, taught by expert artists from New York, people who are trained in narrative medicine. They can choose photography, for example, comics, literature, film, many, many other subjects. And for me, they choose the class called Theater in Action. And these are my playwrights smiling broadly because after only 6 weeks, each of them wrote a 10-minute play. They all acted in each other's plays, and they presented a stage reading of all their plays in public, invited by the New York Society for Ethical Culture. And writing plays, I'm teaching them to develop a rounded character, to step into another person's shoes. I'm teaching them to step into another person's world and understand it. To practice that, they have to practice teamwork by working together. It gives them, they come in with their own problems, but playwriting gives them a few hours just to think about somebody else's problems, their character's problems. And this course is held over only 6 weeks, only 2 hours a week, with 1 hour of homework. But medical students, I commend medical education for instilling a sense of the work ethic in these students. I'm so surprised at what they can create in only 6 weeks. And they themselves, at the end, I asked them to write a process essay that said, I asked them, what does playwriting have to do? I'm not a doctor. You're going to be doctors. What does playwriting have to do with medicine? This is what they say. And the students have given me permission to quote from what they said. Pooja said that writing her plays gave her an opportunity to dig deeper into characters, to see both the good and the bad of each of her characters. Pedro, who wrote a science fiction play about a very unusual world, said that learning to set the rules of his imagined world, learning to understand those rules and to communicate those rules, to have those rules communicated to him, helped him to enter the worlds of his patients, which are many and varied and different from his own world. Steffi said that it really built a sense of teamwork when they were acting in each other's plays, where they learned to be comfortable giving to each other, and also created a sense of safety because they were asked to give feedback to each other while their plays were in process. She said it was a really safe feeling knowing that how to express feedback in a respectful but productive way. Lorenzo said that when he was a child, theater was one of the very safe spaces in his life, and he was so happy to revisit it in adulthood and in his medical education that gave him a time to relax and refresh, take his mind off the everyday. And finally, Ellie said, very surprising to me, because he had a sense of how theater helped with the physician's professional identity, developing professional identity. Ellie said that practicing the role of being a physician over and over gave him hope that he would practice being a physician until it was no longer acting, until it was real. So those are the voices of my students and some of the anecdotes about what's happened. But we've also measured outcomes and observed outcomes. I'll give you just a quick overview of some of the measurements we did, and then I will post a list of the references so you can read these articles in depth and get the numbers and the procedures that were used. Dr. Deepu Gowda, who's been with us since he was in medical, I think a medical resident, has now moved to Kaiser Permanente in California. He's done 2 research studies related to narrative medicine. One, he had a group of medical students who studied art with an expert in art. And he found that the results were that that study increased their observational skills, increased their reflective skills, and increased their awareness of self-care. The details are in the article that you can read. Another project that Deepu Gowda did, Dr. Gowda did, was to assemble 3 groups of interprofessionals in academic clinics, in 3 clinics in New York. He was with them for a year, and I think they did a series of narrative medicine sessions, signature sessions. And it was reported that working interprofessionally helped interprofessional communication. It's tended to soften the clinical hierarchies and increase team collaboration. You can see the numbers in his articles. One of our former students, Jonathan Chow, who is now a psychiatrist, did a research in which he invited HIV patients and preclinical medical students to sit around that narrative medicine table. And they did 5 weeks of creative writing using the narrative medicine methods. And in those 5 weeks, the reports were that the patients and the medical students, despite how different they were in age and experience and background, developed stronger relationships. They reported feeling supported and acknowledged in showing their writing to each other and listening to each other's writing. They reported gaining a better sense of clarity by writing. It's clearer to me what I'm thinking when I see it outside myself. And they were able to write about personal experiences and really take it deep in a safe way. These researches are found here. And in addition, the first entry by Dr. Sharon et al. Is our textbook, The Principles and Practice of Narrative Medicine. Dr. Gowda's research is here, Dr. Chow's research is here, and then a couple of other articles, and one where I worked with David Leventhal, who's a professional dancer, the Mark Morris Dance Company, who had a narrative medicine elective in which his medical students choreograph their patients' stories. So there's much to see in these articles about the outcomes of narrative medicine. If you're interested in narrative medicine, learning more, every Tuesday at 7 a.m. Malaysia time, online, there's a free signature session, 1 hour, Connections in Narrative Medicine. You're welcome to come on Zoom. Anyone is welcome to join. Also, we have workshops and events. We have monthly rounds, and we have a spring workshop and a fall workshop in New York where we train people in the principles and practice of narrative medicine. Dr. Chong has been through that training, and you can get information on our website. You can also get information on the online certificate of professional achievement. You can get a certificate in narrative medicine, and the classes are asynchronous and online. So we have medical professionals from all around the world, and healthcare professionals, and artists and scholars from all around the world who participate. On that same website, you can see also the information about our Masters of Science in Narrative Medicine. That was my training. And that is, right now, that's an on-site master's program in New York City. So I wanted to leave as much time as possible for your questions and your responses. And thank you again. This is my email. Please feel free to reach out to me at Columbia University. Thank you so much for this opportunity. And Dr. Chong is going to read your questions.
Thanks very much, Catherine, for giving us an insight to the introduction of what narrative medicine is and how it's used in Columbia with medical students, and some measurements of the outcomes. We have a comment and a question. Dr. Kusara says, it seems to be formalizing something that doctors were expected to have in a greater or lesser degree from their own personal lives. Strengthening soft skills in a doctor, it's a great idea to upskill the whole group. That was a comment.
Yes, thank you so much for that comment and that insight. It's very true. You know, we tend to think of the arts and humanities as sort of fun and light, and you know, we all know how to read, right? But there's science behind it. You know, there's a science of linguistics, a science of narratology. A dancer has to be extremely technical. And you have those experts in your community so that the doctor doesn't have to do all the doctoring, all the clinical training, and try to read War and Peace with their students. You have a literature professor probably close to your medical school who can come in and who can train in the narrative medicine methods and help, has an expertise in close reading and know how to lead a group and know how to design this, like for example, in a 6 weeks class. I have so much experience in playwriting that I know how to help a student in 6 weeks strengthen some of those skills. The doctors don't have to do it. And I think you'll find, at least speaking from my personal experience, as an artist, as a performer, as a playwright, sometimes we even think of ourselves as doing something that's not so useful. But truly, when I work in the medical world, you know, I feel that here's this student, and sometime this student is going to have her hands on the head of a child, healing this child, and I've had a role in it. So I think this collaboration is extremely important, and thanks for saying that you're open to having artists and humanists help to strengthen those skills.
Prof. Sarah has a question for me. She would like to ask me how much it has changed my practice since doing this course. Interesting question. I came to discover narrative medicine, I think, through my bioethics course in narrative ethics, and I was intrigued about narrative medicine as I read it. It was quite similar to what I do in palliative care, developing the skills of observation, knowing more about myself, and putting myself in patients' shoes, being empathetic, seeing from their perspective. So I recognized there were some similarities, but I guess after attending the course, it perhaps honed in on those skills a little bit more, and realizing there's a whole lot of other ways to get the training to strengthen those skills. We may teach in palliative care to focus on those important skills of putting patients' perspective first, recognize our own biases, but saying it out loud is different from you actually experiencing it and changing yourself. So I think with narrative medicine, I feel it's another way to strengthen the doctor. So which is why I was really excited to meet Rita, who said, you know, if you're in New York, come on and attend this workshop to understand a bit better. And I think it's another way to train our medical students, because I see the output that we have, and there's a lot to improve in our medical students.
I see that the next two questions are about, are medical students in Asia more reserved, and is narrative medicine less likely embraced? are our students ready to embrace something like that? I think Dr. Chong will agree. We had at least 2 medical students attend this 2-day workshop that we presented, which was mostly with their superiors, their supervisors, doctors who had been in practice for 20 years. And those medical students participated wholeheartedly and spoke up. We had some small groups with medical students who didn't know anything about narrative medicine. But when we started looking at a poem, they were all chirping up, yes, this about the poem. And they're very participatory. And I had been told that too, that, Asian students are trained to hold back and not to. Yeah, sometimes people don't volunteer as readily as you do in the United States, but even once encouraged to speak, we found that the medical students participated wholeheartedly.
Yeah, I think it's creating that environment, and that's what happens at the workshop. It's having facilitators who are skilled enough to allow even the quietest person to express themselves. So I think our medical students are definitely ready.
They're ready and wish for it. Dr. Sharon's asking me to say something about Narrative Medicine International. I'm the co-director with Dr. Nellie Herman, who's the creative director of Narrative Medicine, of a core group called Narrative Medicine International. I myself have had 2 Fulbright's degrees, one of which was a narrative medicine Fulbright. I'm a specialist in narrative medicine. I'm encouraging other of the narrative medicine professionals to become a Fulbright specialist. Narrative Medicine International works with several countries in Europe, also Asia, and Australia has a strong program starting. And our methods and practices are spreading all around the world.
I think that's Prof. Sharul has a question. I imagine that there will be a lot of literature on narratives of care for older geriatric population. How will we access this work? As a geriatrician, I work with colleagues in linguistics and dementia. The narrative approach medicine would complete that.
Yeah, that's great. Glad you're mentioning narratives of, illness and care. Those are very important to be studied. And, in med school, we study them sort of technically. I would also like to encourage reading any text, medical or not, because just analyzing a text in and of itself is always going to get down to questions of life and death. 100% chance of death, every person in the room. These questions are always going to come up. I don't know that I can answer immediately where to find all of this relevant literature. All I can say is I have a lot of confidence that it's there, and our medical librarians probably, if asked that question, could be very helpful.
Okay. All right. I think it's 9:01. So thanks very much, Catherine, for sharing. For sharing. Oh, sorry. Prof. Chin wanted to ask a question. Do you want to ask a quick one?
I'll ask separate.
Yeah, we go separately. So Catherine will be here till today, and she's leaving tomorrow. So anybody wants to reach out to her, you can. But I believe everyone has some work to do. So we'll close the session and thank Catherine and Terence and Prof. Chin for the session this morning. Thank you.